request all the participants, please put yourself in a mute mode kindly. It will take 30 seconds more. Yeah, in that meantime, I'm just giving you the permission.
Take your time.
We are on live.
Great. So we can start now?
Absolutely. I'm just giving you the permission to share.
Yeah, please. Yeah, please. Thank you so much.
I think now you can share, and we are on live right now.
Great.
Absolutely, yes.
Slide is visible, right? My slide is visible, is it? Hello?
Yes, it's visible.
Okay.
It's
Yes,
visible,
it's
sir.
visible. It's visible.
Thank you so much, and thanks for the nice introduction. And I once again welcome you all for today's presentation. I will take you through the presentation, and before that, a little brief about myself, though it has been mentioned nicely. Still, I want to share some of the interesting point of mine. So I'm a guy who always, like to see the dream and fulfill that dream, and that's what I did so far. So I have passed out from ECTS in 2006, and then it was my dream to complete my education from abroad. So I went UK, I completed my postgraduate diploma and then in marketing. And then when I came back from UK in 2011, only one wish was there. I could have completed my PhD, and I did that. And after completing my graduation, like my B.Pharm, I joined Doctorates Lab as medical rep. And when I joined, the very first day, they called me for a meeting in a very big hotel, a 5-star kind of hotel. And there I saw a person from head office. He was very, very confident. And he was taking us through the entire kind of strategy, how brands work and all. And since that day, I thought that I will join in this profession only. And that is how I did. So when I came back from UK, I joined pharma company and made, their brand management team, and I work for a company like Intas, IPCA, MCure, Sun Pharma, Sanofi India, and currently with Dr. Lab. So with that, I will start my presentation, and this would be my brief table of content. What I request you is, in my each and every slide, you will get something or other very, very interesting information, which will definitely gonna help you in your near future. So be ready with the notepad and the pen and write it down if you find these info are really important for you. Okay, so here we go. So what we will do, we will first discuss a bit about how the market look like, what are the opportunities, and what is the difference between the pharmaceutical sales and marketing, how marketing works, and the role of branding, and then other few suggestions. With that, here we go. So you can see in your screen, the total pharmaceutical market size in India is quite big. You can see at the bottom of your screen, left side bottom, the total size of Indian pharma industry is 1.48 lakh crore. I'm repeating once again, it is 1.48 lakh crore, which is growing by 7%, and it has added close to 10,000 crore compared to last year. But this is just information. What is the useful of this information? The useful of this information is, you can see I have made bold of few of the therapy area, and I want you to notice this point. If you look at the pharma market, I mean the Indian pharma market, then it is largely divided into two parts. One is chronic and one is acute. So I request you, henceforth, if you get an opportunity to select any segment or therapy in your near future, I request you to go for cardiac market. I request you to go for anti-diabetic market, derma, neuro or CNS and respiratory. You can also go to anti-infective, but it doesn't mean that we should restrict ourselves for other therapy. But yes, these are the therapy in terms of growth, in terms of new molecules are coming. It's quite high, and that is why the perspectives also.
Sorry, I am interrupting you. Can you go for the full screen of your PPT?
It is not full screen, kya? From my end,
No,
it is
no,
showing full screen.
I'm not seeing the full screen. Actually, the half screen.
Sir, it is.
It is full screen.
It is in full screen. Yes,
but,
sir. It is in full screen.
I don't know why it is not coming full screen. Okay. Oh, go ahead, please.
Okay. Thank you so much.
Okay.
So the first point is these are the lucrative market. The second point is from now onwards how I have to prepare myself to enter in this market. I will tell you some of the tricks. This is about the Indian pharmaceutical market. There is another one market called medical devices, and that market is also quite big. I have mentioned few of the big giant. There are many big giants, but Medtronic, J&J, Philips, GE Healthcare, Abbott, these all are the very big name in medical devices, and you can see how big the market is. Sorry?
Please put your... Sorry for the interruption. One of the participants
That's okay. Absolutely okay. So I was talking about the market of medical device, the industry of medical device, and trust me, the paycheck here is quite good compared to pharmaceutical sales or marketing. But here the catch is they don't take the freshers. So you have to spend a couple of years with very good house, big house, probably MNC or Indian giant, and then they will take you. But please keep this point in your mind because the market is very good and the paycheck is very high. The next market is Ayurvedic and OTC market. Again, the huge market, and I have mentioned a few of the companies' name like Dabur India, Imami, Himalaya. These are the very good name. And if you get an opportunity to work with these houses, you will definitely gain a substantial experience as well as your future gonna be very bright. Now come back to the previous point. What I mentioned is you have to always look for few specific therapy area which are really good, and those are like cardiac, anti-infective, anti-diabetic, and all. Now how you will prepare yourself? Now if you want to be master in anti-diabetic market, then in one hand you have the pharmacology book, that the party you have to go through that. At the same time, there are few tricks which you have to remember. You have to Google it. What are the leading guidelines are telling? So ADA is American Diabetes Association. Likewise, IDF is there. There are 2-3 more guidelines. So first understand these guidelines. And these guidelines are really easy. It's very easy. Once you understand the guidelines, then you will came to know, you will got to know which are the molecules are prescribing by the doctors now. And then identify those molecules and go through some of the basic trials of this molecule. So I'm once again, friends, I'm reiterating, to be master in this each segment, you have to first understand some of the guidelines and some of the trials. And if you can do so, then you will become a master on this each therapy, and you can crack any kind of interview, right? I will move to the next slide. So you may ask that, Sanma, you are talking about the market, but which are the big companies in India? And here we go. These are the top 20 big company in India. Number 1 is Sun, followed by Abbott, then Cipla, Mankind. I have mentioned if it is Indian company or whether it is MNC and some of the values. So for you in this point of time, rather than understanding how big they are, it is very important for you to understand which are the top 20 companies. So in near future, when you will join the profession, if you can join these companies, it will really gonna help you, right? Now move to the next one. So we understood how Indian pharma market is. What is the status of medical devices? What are the good companies in Ayurvedic market? Which are the top 20 companies, as well as how I have to prepare myself. Now we will move in and to understand how big the global market is and what is the future of pharmaceutical market. So you can understand these are the therapy area globally which are doing exceedingly well. Oncology is also doing well in India, And if you get an opportunity, you can join Onco also. Really nice, really good therapy area. But globally, Onco will remain #1, followed by anti-diabetic. You can see here, right? So anti-diabetic have a very good perspective because there are numerous trials which are coming in each and every year, and these are the very big trials. These are the few other therapy area, and you can see how the growth would be for WW means worldwide prescription and OTC sale. So what I will do post my presentation, I will share this full text article with Maji sir, and Maji sir probably will share with you. I request you to go through this full text article. It is really nice, and it will help you to understand how the global market is going when it's come to pharmaceutical industry. Now, very, very important point is, what is the scope of pharmacy? When I retrospectively think myself, when I was a student, I explicitly remember a few of the questions were there in our mind, whether we are in a right, stream or not. But now I can understand this is one of the best stream available for the student. If you compare the pharmacy with automobile industry, I can bet on my shirt that you won't find this many varieties are available. Same for IT industry. There are only few varieties are available in IT industry. You take it any industry, you name it any industry, you do your research, and you will get to know that pharmacy having a huge varieties. After B.Pharm, you can join the government job, and look at on your left hand side how many another scopes are available in government job also. You can become a big entrepreneur. You can become an academician. On research, you look at how many streams are available on research. In production, you look at how many streams are available on production. You look at the pharmaceutical marketing. Again, the own shop, the retail shop, as well as sales and marketing. So again, this full text article also I will share with Maji sir, and he will share with you, and you will understand how big the market is, as well as what are the different sub-segments are available for each one of you. And here, my urge to all of you is, from now onwards, friends, you have to, identify what is your dream, in which stream further you want to go. You want to go to research, you want to go to production, you want to come to marketing, you want to be an academician, you want to join government job, and now onwards you have to prepare yourself. So start, seeing the dream and fulfill that dream. And I believe that you don't have much time now, right? So please, do your best, and you will succeed because you are in a very, very, very good stream. Now I will talk about the difference between pharmaceutical sales and marketing. I am from the marketing team. So I will explain how a classical division works. So, for example, in Dr. Reddy's, we have 42 divisions. In Sun Pharma, there were 62 divisions, 66 divisions probably. And each division, they segregated in two parts. One is the marketing part, and another one is the sales part. Sales part is basically led by the national sales head. Then zonal sales head, they report to national sales head. So zonal sales means probably for each region, we are having one zonal sales manager. He or she report to national sales manager. Regional sales manager, for example, West Bengal, there is one regional sales manager, Bihar, one regional sales manager, Northeast, one regional sales manager, they reports to zonal sales manager. And each regional sales manager have 5 area managers, and 5 and more or probably less, and each area managers have 3 to 5 medical reps. So these are the sales colleagues. And on your left hand side, you can see the marketing head. Under marketing head, group product manager. Under group product manager, product executive, management trainee, as well as the product manager also sometimes report to marketing manager. And these guys, they actually sit at head office, whereas from medical representative to zonal sales manager, they always are on field and they play a pivotal role for sales. So this marketing team, they are basically the originator of the brand strategy, whereas the sales colleague, they are the implementer of the brand strategy. And both these arms are equally responsible to bring the new prescription and meet the objective for the division. So this is how the pharmaceutical division works. Now, the question is, if that is so, then how important the brand management team is. So rather than highlighting the importance of brand management, I will tell you what are the works done by the brand management team. And I have mentioned only few. They are involved with many other important works. So start with, they are responsible for the internal and external analysis. So the strategic marketing analysis, the forecasting, these all are the things done by the brand manager. We have a outside organization called IQVIA or IMS. They are responsible. I mean, they are basically help us to get the sales data. So we understand from that data how big the market is, which are the segments are very important, how brands are going. At the same time, there are a company called SMSRC and CMARC. They help us to understand the prescription behavior. So from prescription behavior, we understand in which indication, which are the molecules are prescribed by doctors, which are the other molecules are prescribing by the doctors, which are the brands prescribing by the doctors. So these are the analysis done by us. Then from this analysis, we create the strategy. We create the long-term strategy, and we create the short-term tactics also, and we fortify the brands. We also help organization to identify the key opportunities for the brand, and we prepare the brand plan. That is one of the very, very important job role of us, to prepare a brand plan and ensure and enhance the market share and growth, as well as we are responsible for P&L, and we ensure to meet the financial objective. At the same time, we coordinate with medical team, with training team, and with so many stakeholders to ensure that brand do good in this competitive market. So you can understand how the kind of responsibility each brand manager carries, right? Yeah. Any question? I request all of you to put your mic on mute mode, please.
Yeah, I put them all on mute. You can please continue, Mr. Saturday.
Yeah. So you can understand now the importance of brand management. Now I will give you some of the very relevant example, and then probably you can correlate the role of brand management in FMCG industry as well as the pharma industry. So you must have observed this pocket perfume, right? Nowadays it is very popular, and this thought came from a brand manager. He identified the insights from the customer and came up with this perfume. Again, a job done by a brand manager, a great job done by a brand manager. You remember this advertisement? I request all of you to put your mic on mute mode, please.
Everyone is mute, sir.
I think your one is mute, if you don't mind.
My mic is okay. Yeah.
Thanks. So I believe all of you remember this advertisement, Thanda Matlab Coca-Cola. Now understand the essence of this advertisement. So what was the objective of this advertisement from the Coca-Cola team is, in the summertime, whenever you feel thirsty, you don't go for any cold beverages. You just go for the Coca-Cola. So they have expanded the horizon. And again, this is called a positioning statement. And in all of our mind, it is appropriately incorporated that Thanda Matlab Coca-Cola. A great job done by a brand management. Move to the next one, Kuch Meetha Ho Jaye. Again, a positioning statement and the job done by the brand management. So you can understand the importance of brand management for the brand growth. So these all things is there in our mind. And we always correlate this thing when we buy such kind of goods in the market. I'll move to the next example. In recent past, you must have observed this. और जनाब अभी क्या चल रहा है? हिंदुस्तान में अभी फॉग चल रहा है. So these each and every parameter of branding been invented and nicely crafted by the brand management team. And that's how the importance of brand management is. Now, if you correlate or if you understand that what are the key, kind of theory which we follow. So I have incorporated few of such theory, and we follow some more theories also, but I will quickly take you through all of the importance theory which we follow. The first thing is STP, which is known as segmentation, targeting, and positioning. And these are the cornerstone for the brand management. Any brand, you take it FMCG brand, you take it pharma brand, you take it automobile, anything, anywhere, this funda is very, very relevant and important. So what is segmentation? It is a subgroup which can meet common customer needs within a distinct market mix. We all know about market mix. I will take you through the market mix as well. The target market is a process to focus on marketing resources of a particular part of a market. And the positioning statement, which I mentioned before also, it is very, very important. It actually helps a brand to presence and acceptance by the customer or consumer in the competitive market, which build an image in the customer mind. So why you will choose Thumbs Up, why you will choose Coca-Cola, it's also depend on the positioning statement. The next thing, how to arrive this positioning statement, there is a theory called, or a practice called the brand portrait wheel. So we as a brand manager, we don't get a brand, we actually get a product. So take anti-diabetic brand of mine, it's actually a product. But then how we craft the appropriate positioning statement? So we actually go to the consumer or customer. So here probably the patient we go and we understand that what is your problem. So we try to understand a pain or their aspiration or their goal. Any of the three we understand, and we pick out of these three, we pick any one, preferably pain point if we can pick. Then we correlate this with the rational and emotional benefit, and we resonate this pain point, the patient pain point, with the single-minded proposition. And once we get the SMP, we get the positioning statement. So the definition of positioning statement is, in the market definition, the X brand delivered this single-minded proposition to target customer because it has this many evidence. I will give you one example, then probably you can correlate in my subsequent slide. Now move to the other theories which we follow. You all know SWOT analysis: strength, weakness, opportunity, and threats. Strength and weakness is internal, threats and opportunities are external. We also practice BCG matrix. So star, question mark, dog, and cash cow, and each of these quadrant have a specific kind of strategy which we follow. We also practice the matrix called ANSOF matrix. I will explain this matrix later on in my subsequent slides. So these are the theories which we follow. Also, the patient journey map is very, very important for the brand management. So these entire chart help us to understand in which bucket we will create our strategy. Whether shall we go for brand choice, whether shall we go for fulfillment or adherence. Very, very important slide. I hope you all are taking a note because if you appear the brand management interview, these theories will really gonna help you. If you can explain this theory well, the chances are very high you will likely to get or crack that role, right? We will move to the next one, and here I will try to explain you a role of brand management in one of the big brand in the industry called ISTAVEL and ISTAMET. So these are the, it's come under top 300 brands of IPM. IPM is Indian Pharmaceutical Market. And top 300 brands mean something different. These are the very big brand that doing very, very good at the marketplace. And now a bit of historical perspective. ISTAVEL was introduced by Sun Pharma in 2011 after the three years launch of the innovator brand of Chanuria from MSD. So friends, there are two types of brands available in market. One is generic brand, one is patented brand. patented brand means introduced first time in the market, and they have the exclusivity for 15 to 20 years. And within this time frame, no other companies are allowed to introduce this molecule in the market. So they have the exclusivity. So Sun Pharma did a joint venture with MSD and introduced this brand. That time the challenge was from other molecules like vildagliptin. So ISTAVEL is basically a sitagliptin and anti-diabetic brand. And that's how they launch, and due to very excellent marketing practices, within a very short span of time, they become a top 300 brand in Indian pharma market. Now, I was mentioning about the 4P. So if you want to practice the 4P, that's how you can segregate the 4P. So now it is 7P, but 4P is still relevant. So you can segregate any product or brand in such a way. So product, price, promotion, and place. We also, try to understand the Porter's 5 force. You all know about this theory, Porter's 5 force. So there are threat from the new entrants, threat of the substitution, buyer power, supplier power, and the competitive rivalry. So whenever you will do this kind of thing, you will try to understand this kind of thing. You try to prepare. You take any brand from the market and try to correlate how these Porter's forces works. Then the SWOT analysis also. So on that point of time, we have mentioned the strength and weaknesses as well as the opportunity and threats. I was talking about the ANSOF matrix. So if you understand this brand from the ANSOF matrix perspective, then it has the 4 quadrant: market penetration, market development, diversification, and product development. So if your product is old and if your market is also old, so you have to select the market penetration strategy. Likewise, the market development and product development are also available. But if your product and market both are new, you have to select the diversification strategy. And that's what the Reliance do all the time. They enter into new market with new brand, and they follow the diversification strategy. Now understand the ISTAVEL, as the brand is also old. So I was referring in 2017-18 probably. So even now also the brand is old and the market is also old. But again, to keep the momentum high and ensure the market share, on that point of time, we adopted this quadrant. And as per this quadrant, there are certain recommendations which we followed, and we got a success. A brand portrait wheel, which I discussed with you. So we converted this product feature to the rational and emotional benefits. And what we came to know, as I have mentioned, there are 3 components to understand the patient insight or key customer insights. Either it could be pain, either it could be aspiration and goal. So we identify the pain point. So what that time patient told that I am having a diabetes, but despite having that, I want to live well with diabetes. So this single point came out from that research, and then we crafted the brand essence and the positioning statement. The brand essence was live well with diabetes, and the positioning statement you can see on your right hand side. In 10,000 crore anti-diabetic market, ISTAVEL offers the promise of live well with its superior efficacy, safety, and evidence. And that is how, and if you look at the segmentation, it's basically promote to HCPs, that means healthcare professional, majorly to endo, diabeto, cardio, nephro. Target market is metro, mini metro, tier 1 to tier 6. And because of this excellent positioning statement, if you go and meet any endo, you don't show the brand name. You just tell the live well with diabetes. They will easily correlate it is for ISTAVEL. Now, there are some other creatives from other top 300 brands. So this is from the ISTAVEL, the first one, the promise of live well with diabetes. You can see this, the promise of live well with diabetes. The next brand is Januvia. Again, top 300 brands, and they were talking about strong and steady. Galvus, again, in top 300 brand, you can see their positioning statement. And Trajenta, again, top 300 brand, and you can see their positioning statement. So this positioning statement is play a pivotal role to build any brand, whether it is a pharmaceutical brand or it is a non-pharmaceutical or FMCG brand. Now again, the questions were which I explicitly remember, as I have mentioned earlier in my college days, that whether I have done the mistake or I have chosen the right path. But here, friends, my suggestion, you only have to understand, or when you can understand whether you are in a right stream or not, you have to understand in the tough time. So in 2008, when the recession was there, pharma industry was one of the like great industry, I would say, in terms of growth across the globe. And even if you understand the industry perspective in these unprecedented times of COVID, so let's understand how the other industry is doing and how the pharma industry is doing. Then probably you by yourself will get the answer. So if you understand the growth of pharma industry in the recent scenario, in these unprecedented times of COVID, the growth of pharma industry is much better than the telecom industry. So we are in a right stream. Then you compare our growth with the IT industry, you will find our growth is much better than the IT industry. Then we are in a right stream. Our growth compared to automobile industry is very high, and our growth compared to aviation industry is very high. You take it any industry, you will find the growth of pharma industry, even in this toughest time, is much better than other. And trust me, I have many friends across the industry. I get to know from the telecom industry, IT industry, HR professional, automobile industry. The company asked them to go, but not a single colleagues of mine, whether from the sales team or from the marketing team, the company asked them to go, because we are doing pretty good. And in upcoming days also, the future will be really, really great for all of us. So we are in a right track. It is not at all a mistake. It is a success path which we all have chosen. And trust me, friend, if you understand this pharma industry in right way, you will go to the right stream and you will fulfill all of your dreams. We are almost at the end of my presentation, and there are few suggestions which probably all seniors, all teachers many times suggest you that read and read. I will also tell the same, read, but you have to read the newspaper, which you generally get the advice from the senior. But what I will say, apart from newspaper, what all you have to read books and articles as much as you can. Which kind of books? I'm leaving up to your choice. You can go for marketing books, you can go for story books, for fiction, non-fiction book, anything. But the important point, you make a note. You take this, make a note of this URL. If you go to this URL, you can get, I think, almost 8 to 9 lakhs books, and these all are free. You can download the PDF and you can read. I'm reiterating, please take a note of this URL, go to this URL and download as many books you want. These are available free. My request to all of you is at least complete one book per month. Not only books, I will also request you to read the articles. For medical articles, you can go to PubMed, available free. For marketing articles, you can go to McKinsey. You can download an app from McKinsey, it is free. HBR is chargeable, 8,000 bucks per year, but through LinkedIn, if you access, it is free. For the medical sciences, you can do the subscription of your email through ET Health World and Medscape. So identify the new words which you will come across while reading this book and articles, and use these words as many as you can. The next one, the next suggestion of mine is you have to be well versed with Excel and PowerPoint. There are few tutorials are available on YouTube. Go through that and be well versed with Excel and PowerPoint. The next one is an application called Coursera. It is found in 2012 by Stanford University. It offers free courses, and some of the courses are chargeable also. Charge varies from 500 to 1,500 bucks. So if you want to go to production, to R&D, to marketing, to sales, the N number of courses are available. My request would be you do these courses and you will get the certificate. You will earn the knowledge, as well as during your interview, you can showcase that you have completed these courses, right? So identify course as per your choice. And if you want to join the PMT team, then MBA is mandatory. So think for the MBA if you want to join the PMT team. So I request you invest today for the better tomorrow. And this is our GCTS batch pass out year of 2006. You can see Maji sir here. So all of they did, they actually invested a lot during their education time, and they are well settled now. Many of them are well settled at abroad. Many of us are working as drug inspector. Only 4 of us are working in brand management team. Many of our friends are working as entrepreneurs, academicians, research and development, QA, QC production, and in the sales team of pharmaceutical brands, medical devices, nutraceutical, and they have promoted as well. These are the few relevant opening for brand management. You can make a note. You can reach out to them. You can share your resume with them. Later on, I will share another one number with Maji sir. JISU Cadilla is taking a good number of people, both in sales and marketing, which I will share with Maji sir later on. But for now, these are the openings that are going on in the market. With that team, I wish you all the best. Do the best. You can until you know the better, and once you know the better, do better, better, and better. That's all from my end. And once again, thank you so much for joining us today. And now the session is on. You can ask your query, your questions if you have any.
Sure. Thank you so much, Mr. Chatterjee. It was really indeed a nice presentation. I'm sure all of our students and participants have got a lot of new information from this webinar. So now I'll request all of the participants to unmute yourself, or you can also put the questions in the question box. Yes, sir. Yes, sir.
Sir, how are you, sir?
Yes,
I'm
sir.
fine. Before you start question answering session, let me thank Sanmoy. A big thank you for joining in the webinar of JIS University. Sanmoy, I'm a little busy in other meeting, but I was listening to you. And I am thankful that you have kept my picture also. In the last picture that you shown, I am there.
Right, sir.
And I am happy that you have improved a lot.
Thank you so much.
Thanks for sharing a valuable experience with our students. Please carry on.
Thank you so much, sir. Thank you.
Sakhar, please carry on.
Thank you, Maji sir. Sure, sir. Thank you so much, Maji sir. Thank you so much. So now I'll request all of you, please put your questions in the comment box, in the chat box, or you can unmute yourself or ask directly to the speaker.
So friends, be free and ask if you have any questions. I'm just like you only. I'm still a student from my heart. So ask whatever you want to ask.
So from the students we have, I would like to ask a question, Ms. Chatterjee, that there are a few students in our department who are very, very interested. They also used to ask me and other teachers as well that they want to go to marketing right now. So they want us to suggest something. What should they do? Or what are the last day I went to the university, one student of the third year asked me that, sir, is it very what is the basic necessity to be on a marketing field, because he wanted to join himself in a marketing field. So as per my knowledge, I have said him, but I never been into a marketing industry. So I think you would be the best person to talk about it. Like, what is the basic requirement for being a marketing person? And sometimes they used to get confused about marketing and sales. So if you kindly clear these things up a little bit, that what the difference between marketing and sales. So,
very important question. Even when I was student, I was not aware of what is the marketing and what is the sales. Everything seems like a marketing and everything seems like
right.
So the
Right.
marketing,
Yes.
as I have mentioned in one of my slides, So sales colleagues, they are responsible to interact with the HCPs in day-to-day. They promote the brand, which is supported by the marketing team, and they ensure the new prescription, and thus they ensure the sales and meet the objective. Whereas the marketing team, the responsibility of marketing team is to foresee the brand, where the brand can grow after 5 years, after 1 year, after 2 years, and if it is so, then which are the resources we have to provide to our sales colleague. So these communication piece, everything is developed by the marketing team. Now, if you ask me that what are the mandatory thing for joining sales as well as the marketing, so you have only mentioned there is a difference between sales and marketing team, and I hope I could able to explain the difference between sales and marketing team. So in sales team, if you want to join, the B Farm is more than sufficient, more than sufficient. Okay, you can find good companies, they only take B Farm guys. Many of us, we might have a questions that the BSc guys, the BCom guy also join the sales team as a medical rep. Then why we will join as a B Farm guy? But if you want to join a good company, then they only take the B Farm. Like for example, DRL, they only take B Farm or MBA guys. They don't take any BSc guys. If you go to any MNC, big MNC, they always take the B Farm guys. So that is about the sales, and the sales is also important because I also spent a couple of years in sales. Once you spend a couple of years, you will understand, get to know how sales operates, and then probably you can move to marketing. But it is not mandatory that you must have some experience or relevant experience in sales. But yes, for marketing, the mandatory thing is the MBA. And here I would like to request you, if you are thinking for MBA, then go for a good college. And if possible, you can also look for a college which are in Mumbai, Hyderabad, and Bangalore, because from here to enter in the brand management team would be a bit easy. So MBA is the mandatory thing or mandate. One of my friends during our college, they did the parallel MBA from Lucknow, somewhere in Lucknow. There is one university who used to offer the MBA on brand management, and B Farm student, second year or third year student can do that. Second year student probably. So if you are in second year, you can do so, or else you can do after graduation as well. Hope I could able to answer your questions.
Absolutely, absolutely. And one more question I would be asking you as we got you today. So that a lot of students used to ask that if they're facing an interview in a marketing company, so what should be their beforehand preparation to face the interview? Like what kind of question they should expect to ask them so they can prepare themselves according to that? Because some of the pass out students are really into marketing or they wanted to join the marketing. So if you can guide them a little bit.
Yeah, very important question. I was actually expecting this kind of question from student only. Thank you for asking this question. So again, the marketing and sales is two different and I believe post pharmacy, if you have MBA, you please go for the marketing, or you can come via sales. So if you are appearing for the sales interview, first and foremost thing, you have to be confident enough. So like if you say any wrong thing also, you have to say very confidently. That is the first and foremost thing. The second thing which I have mentioned in my presentation, beginning of my presentation, there are specific segment or therapy which are really lucrative segment, and you have to prepare yourself. And that's how I point out that if I put myself in your shoe as a student, I don't have much time. I have only good time during the Durga Puja, 4-5 days I can enjoy, Kali Puja 1 or 2 days, or Lakshmi Puja 1 day. Other than that, I don't have any time. I have to work a lot, and I have to understand this therapy. So understanding the therapy, you have to understand bit of guidelines and the trials and the basics of KD department. Read the books. I have given the few URL kind of details. Download the books. Please do the free email subscription of ET Health World. So every day at 9 or 10 o'clock, you will get to know what is happening across the India. Medscape, if you can enroll yourself, you will get to know about the the recent happening in pharma industry in trials and all. So there are 2-3 things. One is be confident, be go through these books, these articles, gain the knowledge, understand the trials and the therapy area. You trust me, if you can do so, then you will crack all the interview. There won't be any single interview where you will say that, sir, I'm not able to crack it. These are the 3 cornerstone or basics to clear the interview, and it's not a rocket science. There are n number of people are getting jobs, so you will also get, trust me.
Okay, there is a question from one of the faculty member, Dr. Roshi Maldar. He's asking that to work in a marketing area, higher studies like the M-Pharm is necessary or not? I mean, I think you have answered the question that B-Pharm is
sure. So M-Pharm is always gonna add some value to your PT. But again, I am reiterating, the sales and marketing is different. If you want to come in marketing, then MBA is mandatory. So post B-Pharm, please do the MBA. I have many friends who are done the M-Pharm and MBA, and now they are enjoying a very good post. I know many stalwart of the industry, they done MBA also, M-Pharm and MBA both, and they are enjoying their career and fulfilling their dreams. So M-Pharm is definitely good, but MBA is mandatory. B-Pharm MBA is more than sufficient. If you do M-Pharm MBA, then very good.
That means you suggest MBA in pharmaceutical marketing.
It's good. Yes, it's not good, it's mandate. Because times has gone.
Right.
If you see previous 10 years, some of my colleagues, they were having only B-Pharm, and then after that they did the correspondence MBA. But now that the scenario has changed, and now MBA is mandatory. And I will urge all of the students, those who want to join the sales and marketing team, aim for the marketing. You might have to join the sales team. You do join sales team, understand all the nitty-gritties of sales, how sales operate. But, who come to the marketing team, because as I have mentioned, from our batch, only 4 of us are in marketing team, because getting an entry is a bit difficult, but once you enter, you can get n number of jobs. And this segment or like the marketing of pharmaceutical industry is quite lucrative and very, very good. The future perspective is very good. So don't restrict yourself only on sales. Once you spend around a couple of years, move to marketing.
Right. Thank you. So there are a couple of questions which I was also going to ask. That one of the students maybe asked that, what about the distance MBA? Like there are a couple of times that we used to go for a distance MBA while we are working, and a person who's doing the full-time MBA. So is there any kind of difference of acceptance or something like that?
Yes, there are differences. I will suggest or recommend you to go to the full-time MBA. Because that is always valuable compared to the correspondence or the part-time MBA. So full-time MBA is good. I can see some of them has put a question about the distance MBA. Okay, so I have probably clarified.
Right.
You. So you can do distance MBA, but getting to enter in the marketing field of pharmaceutical industry, the full-time MBA is better. The next question I can see, to work in PMP, only B-Pharm plus MBA is necessary, or marketing experience is necessary along with. So being a freshers, you have to start in some point of time, right? And when you start, you will call it as a fresher. And if you complete your B-Pharm and then MBA, you can directly join as a freshers, as a marketing trainee. You can join, and then subsequently you grow like product executive, product manager, and so on and so forth. So marketing experience is not mandatory, and you won't get, because some point of time you have to join the industry as a freshers. But yes, if you have a bit of, not much, a bit of sales experience, it will further help you to understand the market, but not at all mandatory. Okay, so there are n number of our colleagues who have only done B-Pharm, after that done MBA and joined the industry. So B-Pharm plus MBA is second.
Yeah, I would request you if you can please share this PPT
I
with
saw
us
that
that we can share this.
I will see. I will see. Few points definitely I will share with you.
Yeah,
I will share.
sure.
What are the important
That would be
slides there? I will share with all of you. Sure, I will do
mhm.
that.
Definitely, that will be good. So one more question I would like to ask, because some of the girls like to go to marketing industry, but maybe there is a concept, I don't know it's still there or not, but whenever we used to study B.Pharm or F.Pharm, there used to be a concept that marketing or sales is only for boys, not for girls, or some this kind of concept used to be there. So that a lot of girls who might be interested in marketing, they might not go just because of having that concept in their mind. So if you want to, clarify that.
Absolutely. Again, a question which I was expecting from all of you. So there is no such difference in a male and female both in sales and marketing. If I tell you again, as I have mentioned, that only 4 of us in the marketing in the brand management today, and 2 of them are my female colleagues, my female friends. So not at all there is such kind of differences between male and female. So both of them are doing very well. I can give you one example of my current organization. If you remember in one slide, I have mentioned that's the difference between sales and marketing, how sales colleagues work and how marketing colleagues work, and both of them are important. So zonal sales manager in our division and Dr. Reddy's, she's a female. And she is responsible for entire East Zone. Along with that, Pune region. Earlier, she was also responsible for entire UP, and I mean the half of the country she was responsible for. And she is doing exceedingly well. So no such difference. You all can grow in your career. But only thing, you have to be honest and do your best. The success will come for sure.
Right. Okay, one question, sir, is there from our assistant professor, Mrs. Preeta Bose, that she's asking how to develop marketing skills from a student point of view.
So what my suggestion would be, like you can do such kind of workshop that I've done, which I have done today. There are important theories which industry people can let you know, and they will help you to create a strong nexus between the academics and the professional world, and they will help you out to understand which are the not therapy, sorry, the marketing theories which we follow. And in that way, if you can do so, I think that the student will get benefited, because I have mentioned a few of the theories like STP, like single-minded proposition, brand portrait wheel, the answer matrix. Again, just a minute, sorry. The BCG matrix,
Yeah.
and each workshop can be done on this theory. So in one day you can discuss about the patient journey map. One day you can discuss about the ANSOP and BCG matrix for 30 minutes. It will definitely help the student, because in one hand they have the theoretical knowledge, and once the industry people will help them to understand the practical aspect, it will gonna be benefited. And I believe we can do that, because when I was a student, sorry, but then I don't have that kind of clear kind of understanding about the marketing field of pharma industry. So if you can do that, it will definitely gonna help students, and I think we should do that.
Thank you, sir. Yeah, so there might be some of the more questions. If
Please
I
go
get
on,
that,
go
I will
on. I'm with
definitely
you.
like to email
I'm
you.
with you.
Oh,
Please go
okay,
on.
okay, sure.
Don't worry.
Sure. So one of the student of ours is asking that MBA must go for marketing. I mean, he just
Achha,
wanted
yeah.
to
You
clarify.
asked me
I think
before
you have
also.
answered.
There are, yeah. You asked me before also. There are, in MBA also there are many variants. I will request you to go for marketing on. Go for marketing.
Right.
And again, once again, I'll reiterate: if you want to complete the MBA, go for a. I mean, I know complete from a. I mean, go for a good institute, As well as if you can come out from the West Bengal, if you can complete this from the city like Mumbai, Hyderabad, Bangalore, the chance is going to be very high, because in Calcutta, hardly any head office of pharmaceutical companies are there. It's only handful. And we marketeer are always based at head office. So wherever the maximum head office are available for pharmaceutical industry, you go to that city. The chance is going to be very high to get a job in marketing, pharma marketing.
Right. I'll request all of the participants if you have. Okay. So another student is asking that preparing for CAT exam is good for MBA in pharmacy.
Absolutely. CAT is a mandate if you want to do it from India. And if you have a dream like me, like as I have mentioned, my dream was to go abroad and complete my education. If you have a dream like me, then identify the countries. For UK, IELTS is mandatory, and the minimum score which you have to achieve is 5. But to get a good college, 6, 6.5, and so on and above is mandatory to get a good college. If you want to go to USA, you go for TOEFL, you go for GRE, GMAT rather than GRE, GMAT and TOEFL for USA. Even Australia and New Zealand is also accept the IELTS. So these are the competitive exam there for abroad, but for India, CAT is mandatory.
Right. Another question is there, what type of advantages I'll be having while I'm in marketing and having both MBA and MPharm. So her question is, MBA and MPharm, which kind of benefits that person will be getting if they are having both degree along with BPharm?
Okay, so if he or she would like to join the marketing field, it's very good if you are having MBA and MPharm, but it is not mandatory. Mandatory is BPharm and MBA. But MPharm, MBA, as I have mentioned, I know many stalwart of the industry, they've done the MPharm and MBA and enjoying a very good position. So yes, it's going to be the added advantage if you complete your MPharm and MBA both. I can see there is another one question. Marketing means working as medical.
Another question.
Yeah, marketing means working as medical representative job. This is a very common mental setup.
Yeah.
Can you explain little more scope in pharma marketing for freshers? Yeah. So I have already explained. I will once again explain. The pharma marketing is a very lucrative kind of role and responsibility which we all enjoy. So in our day-to-day work, we are coordinating with many stakeholders, from internal medical team to training team. We initiate certain market research which are very, very interesting. We interact with many patients to understand how they are doing, what are their pain points. We prepare the brand plan. We are responsible for the profit and loss of the organization. We prepare the communication. Like you must have observed that when a medical representative meet to a doctor, he opens some books or iPad kind of thing, and then he detail through that. So the entire piece is developed by us. So medical representative job, as I have mentioned, I request all of you is, even if you enter in the sales job of medical representative, you please try to come to the other part of the world, that is the marketing role. Or you can move to the medical devices where the paycheck is very, very high, which I have mentioned. But a medical representative job will enable you to understand how the entire pharma world works. What are the nitty-gritties? Because if you joined a marketing team and having a bit of knowledge about sales, how to interact with the doctors, what are the common challenges a medical representative confronted in their day-to-day life, your job role will be very easy. And then from marketing team, you can join the training team. Even from sales also, you can join the training team. You can join the research team also. They also play a pivotal role to build a big brand. And these all job roles are based at head office. You can go to business and development. Even from there, from the marketing job, from the brand management, you can go to abroad. For example, Dr. D's are having presences across the globe. So from Dr. D's, you can go to Russia, you can go to UK, US, and you can serve the company. So don't restrict yourself being only a sales representative. From sales representative, you quickly move to marketing field or move to medical devices, or even in that profession also try to get the kind of promotion as quickly as you can. And the sales part is also very good. I mean, I know many of my sales colleagues who are doing exceedingly well and fulfilling their dream and enjoying the life.
Right. There are no more questions as of now. If there any questions comes, I will definitely forward that to you through email to Mr. Chatterjee. So now I will try like to present a small token of appreciation that is from our Department of Pharmaceutical Technology. That is a small token of appreciation for you. So if you can give me a moment, please.
Sure. Thank you so much. So nice of you.
So this is for you, Mr. Chatterjee, the small token of appreciation for our department. I'm going to email that to you later.
Okay. Thanks a lot. Thank you so much. So nice.
Very good. Sanmoy, bhalo theko.
Thank you, sir. Apniyo.
Okay.
Thank you so much, Mr. Chatterjee, and thanks to all of the participants for joining us and for this lovely time. Thank you so much.
Thanks.
So I'm officially ending the meeting.
Yeah. So you end the live streaming. One thing I need to ask: the fourth year students are there, 10 or 12 students. Are they willing?